my personal opinion, I really think that AirCare is a crown jewel of the program. The flight experience that I've had, I wouldn't give up for anything, and really is what makes me thrilled that I came to this particular residency program.
The AirCare program here is definitely one of those sexy things that everybody kind of looks at and says, that's cool, I want to do that. And there's definitely some truth to that. What makes our program unique is the fact that it's mandatory for all residents. There's a resident on every single flight, which is unique compared to other programs.
We actually have a chance in first year to go on some buddy flights where you're flying with another resident and with a flight nurse. And I went on probably about 6 of those as my first year, during the first year. So then as a second year, when you know it's your first flight on your own, it's just going to be you and the nurse. It's a little bit stressful, but it's also a really great learning experience, particularly when you get put in those initial situations where you really have to make the decisions and think on your feet and work collaboratively along with the nurse and consulting with the attending back at the university to come up with a plan, a treatment plan.
It was my first real EMS experience, the first time of really seeing what patient care out in the field is like. You don't understand what EMS does until you're in the back of an ambulance with a screaming head-injured patient while everybody's trying to get an IV in so that you can push drugs and intubate the patient. I mean, you just have no idea what that's like until you're there, and all the challenges that those men and women face out in the field. And it teaches you how to think and do what you can with limited resources.
Could I do this job? Would I be ready to go out and take care of the critically ill at trauma scenes or go to small hospitals and essentially bring university, the world-class care university hospital to a patient in a limited resource environment? And the answer is that you absolutely be ready. And every resident has stories of situations where they were put in, where they overcame and rendered the best care possible on AirCare.
It's sort of like practicing medicine in an austere environment. All you have is your backpack and your monitor, and you have to sometimes solve problems, take care of incredibly sick patients, and some of them can be even long transport times.
When you learn in a classroom setting, or you learn during a simulation, or you even learn in the emergency department, and you're forced to be the decision maker, you have some safety blanket. Either it's a mock situation and the decisions don't really matter, or you have your attending or a senior who is behind you that acts as a safety blanket. And in the field, when you're there at 2 o'clock in the morning and it's you and your flight nurse, it's really the first time, or at least the first time, where I was ever really the decision maker, and that my decision was going to have real consequence and there was going to be no safety blanket behind it.
To go out and land in a field in Indiana and have to make the decision to put a breathing tube in a young child or not, to go out to another hospital and make decisions about whether or not to administer TPA for strokes or not, it absolutely is critical in maturing as a clinician. And it provides you skills and the confidence that you take with you, not only as a 3rd year and a 4th year resident, but out into the future.
Learning to make that decision under pressure is valuable, and something that some people don't get to learn until their first day in clinical practice, and that's not the case for us because of our AirCare experience. So I've had to make the decision of, do I intubate this person or do I not intubate this person, without anybody behind me, and I've had to use my skills and my teaching to affect that person's clinical course. You always have the phone, you have the radio, you can talk to people if you're not sure. But I feel like I've grown as a clinician tremendously because I've been in that position, and without AirCare I wouldn't have been.
We're basically the only trauma center for probably an 80 or 90 mile radius in a tri-state area. Not more than 25 miles from here, we can have some of the most rural counties in Ohio, Indiana, and Kentucky. And frequently we get called by squads from surrounding areas to airlift a patient that sustained either major trauma or has a complex medical condition and bring them back. We've walked in the door to some of these rural emergency departments or rural ICUs even, and the nurses, the first thing they'll say is, "Thank God, AirCare is here. We know the patient will get good care."
I think back to some of the scenarios I was involved in, and I will never forget one in particular. I've told this story a lot of times, but it really is a good one, and that's because it brought it home to me. I was a 2nd year resident landing at a scene, and literally as we're landing, they were getting this little girl out from under a car, She'd been hit by a car and gone underneath. We landed, and she was bad. She was agonal, just barely breathing. The nurse dropped an IV in her like you just can't imagine. Got her intubated, got in the helicopter. We're about halfway back, and she just crashed. Can't hear in the helicopter. Felt the chest, felt some sub-Q air, needled the chest, and got her back. And she survived. We made a difference, and that will never leave me.